Good afternoon, and thank you for joining. The program will begin shortly. Thank you for joining. The program will begin shortly. Good afternoon, everyone, and thank you for joining us today for Converting Insight into Action, Exploring New Connections in Patient Data with Validic. Before we get started, I'd like to cover a few housekeeping items. All attendees are and will remain in listen-only mode. If you have any questions for the panelists, please add them to the Q&A box at the bottom of your screen. We are recording this webinar and will make it available on the ATA website within the next week. And finally, as this is a public event, we remind any media on the line that this webinar's content is to be considered background only. Thank you, and I'll turn it over to Drew to get us started.
Awesome. Thank you so much. I'm really excited to talk with you today. And we are going to discuss how personal health data can help improve the lives of patients. I'm Drew Schiller. I'm the co-founder and CEO of Validic. Validic is a leader in connecting personal health data from the devices people are capturing in their everyday life, whether it's from a wearable device or in-home monitoring device, and delivering the data into the clinical workflow to enable clinicians to deliver personalized care for patients in their everyday workflow. With me today are two distinguished colleagues from ActiveHealth Management, which is part of CVS Health. And I'm going to turn it over to each of them to give a brief introduction. First, I'll turn it to Dr. Leah Rodriguez.
Thank you so much, Drew. I'm happy to be here today. So I am Dr. Leah Rodriguez. I am the Chief Medical Officer for ActiveHealth Management, and we are a whole person health focused population health company that's able to deliver on population health offerings, fairly comprehensive solutions. My background, I'm a pediatrician by training. And so throughout my career, I've really dedicated myself to thinking of ways to improve the lives of children. And I started actually in private practice, transitioned into the community healthcare space, and then transitioned into managed care when I really started realizing that the greatest impact that I could have on generations of children was actually through generational health. So really transforming the lives and well-being of those adult caregivers in their caregiver ecosystem. And so I'm really excited to be a part of ActiveHealth Management, where our mission to empower people to improve their lives, in body, mind, and spirit, just 1% at a time, right? That truly precision population health focus. I'm really excited that resonates with my personal mission. I'm really excited to share how we are partnering with you at Validic to really use data to help people on their path to better health.
Awesome. Thank you, Dr. Rodriguez. I'm going to make sure that I call Leah Rodriguez, Dr. Rodriguez, because we have another Leah on the call as well, Leah Briggs. And please introduce yourself and share a little bit about your background.
Hi, I'm Leah Briggs. I'm a registered nurse, and my clinical background was in emergency medicine before I transitioned over to the population health management space. Here at ActiveHealth, I lead the product portfolio for ActiveHealth Management, which includes a pretty comprehensive suite of products that are centered around our ability to ingest and normalize and create clinical insights from data, and we deliver them to members and patients through a diverse set of products delivered through interdisciplinary professionals, from registered nurses to health coaches, and then also to digital programs, so members can access the programs on a self-serve type of basis, all to support that population health management focus.
Awesome. Thank you so much. I really appreciate that. And just to maybe tie together two things, one thing that each of you said as we start to lead into a question. And by the way, I'm going to be playing a little bit of player coach today in this webinar. I'm serving as the moderator and will also provide my own color commentary. First, one thing, Dr. Rodriguez, you said was something that really is important to me, is that you worked in community health centers. And oftentimes this is a portion of the population that is unfortunately left behind by healthcare advances and technology, things that, you would find with personalized care and how we can better engage folks in populations around their health. And one really positive thing that I want to share on that note, and I want to turn to you in a second with a question further around this, is that we work with a federally qualified health center, community health center in the Philadelphia area, and they put over 1,000 patients in a hypertension monitoring program. And we were extremely pleased to see that those results, because honestly, we weren't sure how it was going to work, because these are folks who, again, they're not always available to afford a device. The federally qualified health centers are not able to necessarily afford them. They had a grant program for some patients who were able to bring their own devices for others. So we were able to see a ton of success in that management. And I just want to call that out. And then I want to dovetail that with what Leah Briggs mentioned around the ability to bring in all of the disparate clinical insights from the EHR, but also from the data that people are capturing in their daily life, which is really the important piece of what kind of brings this together to enable better care. And so, Dr. Rodriguez, to turn to you with the first question, we have all this EHR clinical data, and we have other clinical data sources, but they oftentimes don't actually work together. One of the things that I've always been really impressed in my conversations and work with ActiveHealth management is your care engine solution and how you can better integrate data from all these disparate sources. And I'm just curious if you can give us an idea of how that helps you achieve a better clinical picture.
Thanks for that great question. And absolutely, I think the care engine is actually one of those really exciting aspects of ActiveHealth that Leah talked about, right? The idea of being able to kind of gather data sources from multiple areas and really being able to convert those into insights and action, exactly what we're talking about today. So I think that for those that are on the webinar today, it is no surprise that there are a multitude of EMRs out there, and that depending on the on how well resourced right your health system is or isn't, the ability to actually exchange information can be quite challenging. And I'll say that actually, as both a healthcare provider and a healthcare consumer, I think even when you are in a well-researched EMR, where there are existing ways to leverage those that interconnectivity, it isn't necessarily optimized or used equally by all clinicians. And so to that end, right, when we think of the care engine, what the care engine platform has done is it's actually able to aggregate data sources from multiple EMRs. It's able to aggregate claims data from both pharmacy and again, multi-payer claims data, both pharmacy, dental, and vision. It's able to aggregate lab data. It's able to aggregate biometric data. It's able to aggregate feedback provided by providers and feedback provided by members, et cetera. And it all runs through the same system to then deliver complete insights on a person's holistic well-being, right? So we're able to identify both where a person's doing well and where there exist the most important opportunities for that person to improve upon their health. And like Leah mentioned, then we use that to power, right, the communications that we have with our participants, whether it be through our personal coaching, through our digital coaching. And we actually are also able to provide these insights to providers, putting that information in their hands to provide them a more complete clinical picture that might not have had just from the information that's in their particular EMR.
Yeah, that is so great. And that 360-degree view, I think, is so critical. And as I think about what that means for the frontline healthcare workers, right? So when they are actually looking at at a patient view of who they're talking to, it's nice to know more about that patient than maybe like an outdated medication list and the last appointment that they had within a particular health system, which may have been from a couple of years ago because they switched providers, right? And so that unified view, I think, is so critical. And Leah, I know that you mentioned one of the portfolio products that you oversee is the care team and their ability to deliver the care or the product that the care team uses, I guess, and the ability to deliver care for these patients. I'm wondering if you can share how this type of integration actually changes and improves the way that they interact with the patient population.
Yeah, absolutely. And, as Leah talks about the disparate sources of information and overwhelming sources of information, it's important to know that while we have more data now than we've ever had on patients, we have less time with our patients than we ever did. And so taking that data and turning it into something that is usable and actionable right away is critical for the clinicians that deliver our programs, but also for providers in practice. Asking a provider to comb through multiple EHRs and HMPs is just, it's not possible any longer. And so what our care engine is able to do is to get those evidence-based recommendations in the hands of our clinicians, whether it's the provider treating the patient or the clinician delivering our program, our population health programs. And in addition, we're able to find the right targeted intervention for those members. So when we think about people wanting to work on their health behaviors and making change, what works for me doesn't always work for Drew or for Dr. Leah. And so we're able to use the insights both from their health profile as well as their behavioral health profile, right? And I don't mean mental health. I mean how they want to interact, how they'll respond to us, what technique might work better for one person over another. And those insights are just as valuable as the health profile, because our goal ultimately with any population health management program is to influence sustained behavior change. That's what we're all going for here. So without those insights, we would be kind of shooting in the dark. And so those insights get us 3 steps closer to where we want to be and where the patient wants to be.
Yeah, I really love that. And, one thing that I've been thinking a lot about is the consumer experience here as a patient, but also just us as people. And in our daily lives, we have personalized interactions with companies all the time. So, what we watch on Netflix or what we buy on Amazon, or, what happens when we get marketed to from a particular organization, all of these messages are really tailored to us. And McKinsey actually has data that says that 71% of consumers now expect these personalized interactions, and 76% of them actually get frustrated when they don't receive them. And so we as consumers have a completely different level of expectation of, we expect people to know us. We expect people to have the information that they need about us. We don't feel like we should be telling you, like, you should already have that, right? And I think a big piece of that puzzle is what's happening in people's daily lives, right? So the devices that they're using to maybe track their health condition in the home via maybe a wearable device or a home health biometric monitoring device. And so Leah, Briggs, to keep it with you, maybe I'm just curious, I know this is an area that we collaborate on a lot. How do you see these wearables and in-home monitoring device technologies contributing to and enhancing the health solutions that you offer?
Yeah, so here at ActiveHealth, we were actually one of the early adopters of including the trackers and the wearables to some of the first wrist-worn activity monitors to devices that were available off the retail shelf. And but it hasn't been that long ago that clinicians like myself and Dr. Rodriguez, we were a little skeptical of some of the outcomes on these devices. The evolution of the market and the industry as a whole has really allowed us as clinicians to, exhale and go, what, there's something here. And this actually can help in between our visits and become an extension of our treatment plan, an extension of our care plan, and provide insights that I would otherwise not know. I would be reliant on self-reported data. And let me tell you, ask me about my diet, what I had yesterday for lunch. It's going to look different if I have a wearable or an app tracking that for me. Self-reported data is still a little questionable sometimes, but that data that's coming in from the devices, there's a little bit more strength to that these days, and that we credit that to the evolution of the market in itself. And there is no shortage of new devices coming out on the market. As we look to partner with, a reputable vendor in this space, Validic really popped out to us as somebody who was critically evaluating the new devices that are coming out in the market and providing us with really good strategy and insight into the market to make sure that the devices that we are not just connecting and absorbing the data, but now beginning to actually hand out and provision to our patients, that they are reputable and proven and reliable. And that was pretty important for us. We continue to see, a relaxation, I think, both from clinicians and members on their trust of these devices. And I think that's going to bring more devices to the market that can bring us those insights. Like, for example, we may not think about sleep as being such a critical health biometric, but it really is. Sleep disturbances and the ability for us to track that through a wearable device is a great example of how we can get 3 steps ahead of an escalation with some of our family members and patients and friends that are dealing with mental health issues. Sometimes that sleep disturbance is the first thing that they actually begin experiencing without even attributing it to that. We envision programs that begin to start catching them, not when the first obvious clinical sign of an escalation is happening, but 3 steps ahead. That's what the wearables do for us.
Absolutely. That's so great. And thank you for the kind words about Validic. We love our partnership. But I'll say, so on that point of sleep, it's so critical. And it's something that we oftentimes, Validic, we are bringing in any data that people are capturing in their daily lives once they authorize us, obviously, to capture it. And we find that we have lots of sleep data from these wearable devices that are not always, brought in and used for the clinical context. And I do think there's a big opportunity there. My wife is actually a clinical psychologist on faculty at the UNC School of Medicine. And she runs the postpartum depression inpatient unit and the Center for Women's Mood Disorders. And so she sees a lot of women who are peripartum and perimenopause. And sleep is such a huge indicator for their own health and wellness and well-being. It's huge, and it's not something that is part of, I think, the day-to-day of how we deliver care yet. But I think it's going to be. And so, I'd love to turn actually that question over to you, Dr. Rodriguez, and say, like, as a clinician, right? You're able to now see things about a patient you couldn't see before, maybe provide them more tailored guidance based on what the data actually is, as opposed to a nervous, anxious patient trying to remember things on the fly, which is not always the best source of truth. I'm just curious, how does this change how you interact with patients and the type of whole being care that you can provide?
Yeah, absolutely. And so as you think about it, right, I think Leah's touched on some great points. The amount of data that we're getting, both from wearable devices that are like off the shelf, right, like the watch you may be wearing or your fitness tracker, is coupling, right, with the medical devices that are also available that can track, for example, continuous glucose monitors, Bluetooth empowered blood pressure monitors, right? So the wealth of data that we can gather where health is happening, right? Because I think that's one of those things that we always forget. Like, we exist as patients for a very small part of our lives, and that interaction between patient and clinician takes up a very small part of a person's whole person well-being, right? And so there's a couple of ways to think about this. There's the aspect of what does that information provide me as a clinician, right? So it's definitely going to fuel and provide me a more comprehensive clinical picture of what's going on with that person beyond what they are sharing, what they remember to share, what they are willing to share, right? Like, there's so many different aspects to that relationship where that wearable device information actually provides a more comprehensive picture of what's going on with a patient's clinical condition. I think Leah also touched on the idea, right? Like, the idea that it's going to highlight potential red flags, et cetera, that are coming up, that is going to be really powerful. I also like to think about it in terms of what it's doing for the patient or the member or the healthcare consumer themselves, right? Because again, healthcare is just one aspect of a person's well-being. And I am a professional, a mom, I'm busy, my day-to-day, I don't necessarily have time to think about my health that much, right? So what these wearables are doing is actually also allowing for a person to be able to keep track of what's going on with their health, and then so programs like ours can actually be tracking in the background what's happening with a person's well-being, and then identify, hey, this red flag is up there. This is actually something that you can now prioritize and take care of, rather than having to be constantly tracking that yourself, right? So you can apply that to anything, both from like lifestyle risk factors, right? Like you can tell whether a person's being sedentary or not, and it can actually prompt positive behavior change, but also even from like the medical information, right? So when we start having wearables that are tracking pulse or sleep patterns, et cetera, and there's things that our data, that our evidence-based protocols can identify are a red flag for something that's going on, then we can actually prompt that person to take action and go back to their healthcare provider, right? So it's that partnership with that additional layer of information that allows us to really help that person achieve a greater sense of well-being, having one less thing to worry about.
Yeah, absolutely. I mean, plus one to all that. And just to share a quick anecdote on that point exactly. We have in the past had a patient go through one of our programs. His name is Steve. We have permission to share his story, and Steve he lives in California, and he had uncontrolled diabetes for over a decade. He was in his 50s. Because of this, he was getting really sick. Like he was overweight. His A1C was over 9. He was having trouble sleeping. He was so exhausted during the day that he actually had to quit his full-time job because he just was too sick. And he would go in for his quarterly checkups with his clinician. And, they would do the normal stuff like, hey, Steve, what's been happening since the last time we saw you? And, here, let's do your A1C check. And then the doctor would come in and say, well, Steve, I don't know what to tell you. Your A1C is still really high. Like, you need to try to eat healthier and try to get out for some more walks. And Steve's like, Doc, I'm trying to. Like, and he would show his phone. He'd be like, here's my glucose readings on my phone. Like, can you tell me what to do? And the doc's like, I don't know how to interpret this data on your phone. Like, it's not, but I can tell you that it's not working. So he was upping his insulin levels. It was just really, and nothing was working. So he left that physician and went and found a different healthcare provider that happened to be using Validic to bring data into the clinical workflow. And so in Steve's first appointment, the nurse helped him connect his glucose meter to the program, to the app, which then would deliver the data into the clinical workflow. So at Steve's second appointment, he shows up and the glucose data is all right there in the patient's chart. And so the nurse was able to see that and say, hey, Steve, I see that you're tracking really well. Like, you were really trying hard here. And we also show a view that shows glucose readings graphed over a 24-hour period. So you can tell how well they check regularly at certain times a day. And so the nurse was able to say, hey, I see you're tracking really well at these times of day, but what's going on between 7 and 9 p.m. at night? Because your glucose levels are higher, but we need to understand what's going on. So it turns out that Steve was having a snack with his family while he was watching movies in the evenings. It was kind of their routine. But he's like, but it's a healthy snack. It's non-salt, non-butter popcorn. And the nurse is like, actually, Steve, like, popcorn's probably not a great snack for you. He's like, no, there's nothing on it. And she said, I know that, but this is still probably not great for you. So he cut out the popcorn, and within 30 days, his A1C dropped by 0.5 point. And so that was the first time that he'd ever made a behavior change that was a recommendation, that because it was specific and it was directly about him and his actions, it really improved his health. And now, Steve, I'm happy to say that he's continued to work with that same care team over the last several years, and he's now lost 50 pounds. His A1C is below 6. His medication is controlled. He organic gardens. He swims regularly. Like, just a completely different person because he was able to get healthy. And it was truthfully the data that unlocked a better conversation between the care team and him that really led to that health improvement. So just plus one to what you just said. Thank you so much. And I think maybe, Leah, I'd love to get your thoughts a little bit more about that. And I just gave an example of how insights can like directly, transform sort of the conversation with patients. I'm curious how, ActiveHealth is using these data to help your care team and others provide better insights at the individual patient level.
Yeah, so a really great kind of follow-up story to that as well is same situation. Getting a device into patients' hands can absolutely create our ability to give them precision and targeted interventions for them. So, if we could all lose weight just because our doctor told us we needed to lose weight, none of us would have a job.
Done.
But
Yeah.
that doesn't work. Getting into their daily routine, and that's exactly what ActiveHealth does, is we create programs that are meant to influence change where it happens in between those visits, in your day-to-day life. And the devices, what we find, really have the ability to bring a tangible, something they can hold that they can now relate to their decisions. So, it's a different conversation when you're a registered nurse, a health coach, working with your member on maybe their heart health and their hypertension, and they're telling you, hey, like I don't know why I feel so bad today, and we take a look back at their readings and we can start to see exactly what Drew saw and your patient saw, right? That cookout over the weekend where you just couldn't turn up Mama's chili corn dogs, chili hot dogs, right? Actually now your blood pressure's through the roof, and you weren't equating those headaches to your diet 2 days ago. Now they've got something in their hand that they can track that, and we can begin to teach them how to correlate lifestyle choices and how those lifestyle choices actually impact their ultimate condition management. And in addition, it allows us to be in almost near real time with the patient. Again, something that we can't do in offices, right? We need to be able to do it in between the visits, and being able to react to the data, whether it's the wearable data or data that we see in the EHR. Having it available is one thing. Reacting to it is where the change comes in. So having that delivered to our clinicians and our provider partners to be able to intervene when we see that escalation starting to creep up or that blood pressure starting to creep up, maybe before the patient has seen it, or even better, providing that positive encouragement when we see they lost 1 pound. That's something you're not gonna always see. But if we break it down into the micro goals, the small baby steps to get them to a better state of wellness, we can be in those moments with them, the positive ones and the negative ones, to help reinforce the good behaviors and redirect where we might have a new idea based on the data that's coming in the situations. And so the data is critical to making sure that we continue to evolve the programs into a space where they make sense for you, not necessarily for the group of people that look like you, but you. And that's always our end state and our end goal. We'll continue to keep working that until we get right down to that exact recommendation that we have for you.
I love that last point, for you, not the aggregate version of yourself. not like you as part of a broad population, but actually you as an individual. I think that's so hugely important. I was talking with a chief nursing officer of a health system a couple of weeks ago, and we were having a conversation around this topic, and she said, the reason why I love the concept of bringing the data in so that nurses can understand my nurses can understand what's happening in people's daily lives is it's an opportunity for education, right? And like when we're doing this correctly, like your team, Leah, is not going to be saying the same thing to that same person every time, right? They're going to be hopefully evolving the conversation, because each time they're teaching that patient like a new tool to put in their tool bag for how they can better manage their own conditions, right? Like that's ultimately the goal of what we're trying to do. I'm going to tell the audience right now, if you guys have questions, comments, thoughts, if you could just pop them into the Q&A box. We'd love to take those live on air, if you will. So Dr. Rodriguez, I have a question building off of this, and it's relating kind of back to the beginning when you were talking about work that you did in the community health centers. I think a big opportunity here around, personalizing care with these data is to help advance us toward a more equitable health system. I'm wondering if you can comment on how you see that taking shape.
Now you got me where I'm passionate. So, stop me if I talk too much. So Drew, I'm very sensitive to our audience, right? And so I think that as we think about advancing health equity, when we think about the great advantages that advancing, telemedicine has brought to that space, we have to be very grateful for that, right? Like, so we know that telemedicine has created an opportunity for increased access and for more equitable care. And so we definitely want to build off on those things, right? So thinking of, HHS Healthy People 2030, right? We're looking at eliminating health disparities. So we need to identify them and then address them. We need to, help people achieve health literacy and ultimately achieve health equity. So I'll touch a little bit on the eliminating health disparities. One of the challenges with, addressing inequities in health is the idea that there are people that whose care is not being addressed because they're not necessarily being seen in the traditional healthcare system. So when you take a wealth of information like we do, right? We're not identifying people based on the information that is just coming from like one system or one interaction. We're actually able to find information from multiple systems and hopefully identify those that are kind of lost in the shuffle, and then help them re-engage with the health system in the way that's right for them, right? Talk to them in a way that resonates with them, and then hopefully help advance their well-being through data-driven insights, right? So again, we're looking for those that are not being found by the traditional system. I think the other aspect is really around kind of that addressing health literacy, right? So we are really looking at how we empower people with information that they are able to understand so that they can take charge of their own health. So as we take all that data from the disparate sources, we are able to actually put it back in people's hands, but in a way that is digested, in a way that is clinically sound, in a way that is information that they are ready to receive, and in a way that they want to receive it. So in those ways, right, identifying those people that are commonly lost in the shuffle and then empowering them with information that makes sense to them is some of those ways that we're hoping to advance the work in this space. There's a lot to be done, and this is just a drop in the bucket. I do not pretend that this will solve, this won't save the world, but it's one step forward that we're excited to take.
Yeah, absolutely. No, thank you for that. And you're right. It is a really big challenge, right? But this is the work. I mean, quite frankly, like this is why my team shows up. I'm sure that it seems like this is a big driver for your team as well. Is we don't want to, deliver healthcare for the well-insured few who can afford good healthcare. Like we want to improve health for everybody. And when you say everybody, you have to really be intentional and thoughtful about what that means. And one of the sort of gotcha questions that I often get asked about our remote care programs is, well, what happens when people don't want to participate? And I'm like, well, okay, look, like name any program ever, anywhere, not even just in healthcare, where you get 100% participation. Like it's just not, you're just not going to get that, right? And like, let's not pretend that we are. But one time actually I was on a call and that question was asked, and a clinician actually from the same organization that was asked that question said, no, you're not thinking about this the right way. He said, for me, there's always going to be people who don't participate in these programs or who we can't otherwise engage with this particular solution. But when most of the people are in these programs, they learn to better self-manage. So I know they're okay. That then gives me more time to spend with the folks who are not using these programs. And then I can understand what will work for them. But I couldn't spend that time with them if I didn't know that everybody else was okay and I didn't have to run off to some other meeting or some other appointment. And so I thought that was such a really great point where, you know, this is a population health approach, right? It's not just we are talking about caring for individuals, but when you have everybody from a population in these programs, you can start to understand who needs a little bit more time and attention versus who's doing like largely okay. And so we can have just like little educational touch points. So Adam asked us a great question, and I'm going to direct this, Leah, over to you, Leah Briggs. Adam says, great dialogue, thank you. The wealth of data to identify patient need and plans is great, but how have you perhaps used the same tools, insights, or other to engage patients in that care?
Oh, the holy grail. Engaging people, right? It's what you just talked about, Drew. We never see 100% engagement in almost any program. One of the things that we have done here at ActiveHealth is to really start to take a different approach towards our population health management programs. And what you mentioned earlier about the Netflixes of the world and the personalization, we're all very comfortable with that hyper personalization, right, in our personal life. But the health systems and the health ecosystem has been very slow to adapt that technology. ActiveHealth is moving rapidly into that space. We've always long had the member health profile with the wealth of clinical information that we know about you as an individual. But now we are moving into this space where we're now collating your behavioral insights, right? What time did you open that email? Maybe instead of me messaging you at 9 a.m. when you're on conference calls all day, I'm going to actually message you at 10 p.m. because I've noticed that's when you start to engage with health related information and the tools that we put out there. So those insights are just as valuable because frankly, if I just put out insights and we don't actually get them into the hands of the providers or the patients who can do something about it, it's useless. And so Adam's question is great, that we have to get information out there and we have to use this insights to get it at a place where they can pick it up and where they want to digest it, when they want to digest it, not at my convenience, but at the convenience of the member when they're ready to make that change.
Yeah, absolutely. Yeah, thank you so much. I think that's exactly right. Dr. Rodriguez, anything to add to that?
Yeah, I just wanted to build on that because I think that also even gets to the idea of health equity, right? So I think, Drew, you touched earlier in the conversation around the idea that when we look, and this does definitely come from that my own background at an FQHC for 5 years, right? When we think of the challenges that are faced by varying populations, not everyone has the privilege of being able to take off, right, like an hour to speak with your coach during the middle of your workday, or even be able to engage in their health and well-being during regular work hours, right? Because depending on where you are in your work responsibilities, those are just not options, right? Whether it's lost income or lack of ability to take time off. And so as we are able to develop more personalized insights, I think it's exactly what Leah says, right? We are able to deliver the message at a time where you are able to receive it, and then we are able to engage you in a way that allows you to incorporate it into your life, despite of barriers and challenges that exist for you, because we are aware of them and we are working with you, right, to do it in a way that makes sense for you. So it really is that it really is impacting populations, but really one person at a time that makes the difference.
Yeah, that's so true. Yeah, thank you for that. It's such a great point. And my friend, Dr. Stephen LaBeouf asked a question, always the antagonist, which is how much data is too much for clinicians to review? So Dr. Rodriguez, I'll turn this to you. He says, for example, at what cadence does information help? Like, are glucose readings and BP readings needed hourly, daily, weekly, monthly? What's important here?
I think that's a great question. So first, as a data nerd, I'll say like there's never too much data, but the question then becomes how do you use it, right? And that's where intelligent data monitoring becomes important, right? So we are receiving a wealth of information. Not everything needs to be acted on. Not everything needs to lead to a response, but we're tracking it and we're monitoring. And when something does come up that we think that action needs to be taken on, we want to make sure that that gets into the hands of the person that needs to take action, whether that's the provider or whether that's the patient, right? So it's really not about the wealth of data. It's about how you manage that data intelligently and in an evidence-based way. I hope that answers that, and I'm happy to build on if there's additional kind of.
No, I think that's great. And I'll just share really quick that, so an anecdote, and then Leah, I'd love to hear your thoughts on this as well. So the anecdote is that we elevate clinical escalations in the EHR clinical workflow, for care teams, for example. And one of the things that I always say when I get asked this is, if your clinical team is complaining about receiving too many alerts, then you've done a poor job of setting up the program, because like these should not be FYI alerts, because you can, to your point, Dr. Rodriguez, you can always go see the data, right? But the alerts should be, they should be like, oh crap alerts, like I actually really want to know this, like thank you so much. If your clinicians are not appreciative for receiving the alert, you need to adjust the thresholds to make it something that they do want to pay attention to, because what we don't want is for them to just dismiss these, and then because then they might miss something that actually is really important. So Leah, I'm curious, your care team is going to be the one who's who are reviewing these. Like how do you help them think about this?
Yeah. Yeah, and it's the way that cried wolf, right? We want to make sure we get the right data in the hands when it's necessary. And as a product team, and as our products evolve, you will never hear us push forth our particular idea of that frequency of monitoring. It's really critical in all of our programs that we support the relationship between the patient and their physician, their chosen physician. So in all of our programs, we are coordinating with the treating physicians to make sure that if they want it daily, weekly, monthly, that we are reinforcing their treatment plan and not providing, disjointed information and recommendations, because we want to support and complement the physician-patient relationship, not disrupt it. And so that's kind of our perspective on it, is that you won't necessarily hear us push forth a theory on that. Rather, we support the physician's plan of care. And in absence of that, evidence-based literature is where Dr. Leah Rodriguez and her team always head for.
Awesome. Yeah, thank you so much. And so just letting the audience know we have time for a couple more questions if folks have them. Leah, I'm going to actually ask you a question here, going a little bit back toward engagement. And I'm curious how, because active health management has a rich history of engagement across the entire health spectrum, right? From wellness to clinical programs. How do you actually encourage patient participation in these programs and help people understand why these programs are something important for them to participate in?
Yeah. So that's again, age-old question that anybody in the population health space, we have great ideas, great programs to improve health, but if nobody's here, it's not doing anything good. So one of the things that we like to do is to really get to the heart of their motivation, right? What is their intrinsic motivation for making this health change? And a lot of times patients don't know the answer to that. So we utilize motivational interviewing techniques to sort of kind of draw that out of them and get them to see their why. Because once we are able to start answering the why, then things start clicking, right? It's not that I need to get my A1C in line. Very rarely do we hear that as my why. It's that I don't want to lose a foot like my great grandmother did. Like I remember her losing a foot, right? That's my motivation. That's a perfectly acceptable motivation. And getting that out of somebody and helping them to see their why and make that connection has proven to be a really effective technique at engaging them and keeping them engaged, because that first conversation is usually pretty good, but you got to keep it going. Sustained behavior changes do not happen one and done. And so it's pretty critical to develop that personal relationship and really for the patients to see that we're in it for the long haul, right? We're not going to, 10-minute coaching call and you're done. We're in it. If you want to talk for an hour, we're going to talk for an hour. We're going to get there together, no matter how long it takes. And I think making sure that the patients understand that from the get-go, moment one, I'm here for you. I'm not here to roll through and get to the next patient. I'm here for you. This is the only thing we're going to talk about right now. And that has really allowed us to get to the motivation as well as endear ourselves to our patients that we're trying to coach, and has allowed us to find a lot of really successful outcomes and stories that we could go on for days talking about our success outcomes. But I think that's been critical for our success as a company.
Absolutely. Yeah, that's so great. And I really appreciate that your team really works to build that relationship with patients rather than feeling like they're just churning through. I feel like that is such a common complaint that I hear relayed to me pretty frequently, is patients feel like I think I got my questions answered, but I'm not sure. I need to think about what just happened. So Dr. Rodriguez, I'm curious if you have any additional thoughts on that from your perspective.
Well, I think the other thing I would add, right, is that multimodal engagement, right? Going back to the idea of making sure that it's right for that one person and making sure that we have accessibility for all. So Leah touches on our amazing results that we get from that one-on-one coaching perspective, but we also know that sometimes people need to feel like engaged. You know, that's kind of, I say, you know, we're addressing spirit, that connection to ourselves and that connection to others. Mm-hmm. And so, for example, we offer group coaching as well, right? Which allows you to kind of be embedded in a community of others that are having similar things and create that camaraderie and that sense of belonging that can also help be a motivating factor for some. And then for some, like I'm one lately, like if it's not something that I can solve through my smartphone, I don't have time for it. So we're also able to offer those solutions via, you know, digital engagement journeys so that it's self-serve, no one's bothering me, no one's telling me when or where to do it, and I can just do it at my convenience. So really, I think offering that multimodal model, that's a lot of M's, but really offering the variety of ways to engage is also very important when working with people to engage and move them in their path to better health.
I love that. Yeah. Make it convenient for the patient, right? Not just convenient for the clinician, right? I remember at one time early in the telehealth wars, this was probably a decade ago at this point. I was speaking with a cardiology group at a health system. And one of the elderly, that's probably not the right thing to say. One of the more senior physicians in the cardiology practice said, I don't understand telehealth. It doesn't seem to work. And I said, well, tell me what happened. He said, well, so I set it up and I'm in my home and I, you know, have the camera set up and everything else. And then, you know, the patients, you know, they go into the clinic and they check in and then they sit in front of the camera there. But the patients don't show up on site there just as often as they don't show up for my regular in-person appointments. And we're like, yeah, but it's supposed to be virtual for them too. Like it's not, right? Like it's supposed to be convenient for the patient, not just convenient for you in that particular experience. So I always think about that in terms of like meeting people where they are and how we need to change that sort of mindset a little bit in healthcare. I want to just name a couple of things here. One is we've been talking a lot about healthcare, right? In general, we've been talking about personalizing healthcare and the personal health data, right? Well, we've not been talking about our, you know, really specific tactics, right? Like, you know, remote patient monitoring and this, like we're talking about whole person care. And I think that's really important to elevate as part of this conversation, right? We're talking about the whole patient and it all matters, right? And the way that you're able to bring in data across EMRs, across labs, across personal health data that people capture in their daily lives, across behavioral information. And that sort of holistic view is really important to treating the whole person. And so I just want to maybe, you know, get your thoughts, Dr. Rodriguez, on, so, you know, oftentimes we end up they're sort of stuck in tactics, right? But I don't think it's tools that clinicians need, right? Clinicians don't need more tools, right? They need better information to make their lives easier. And I'm just curious if you can more speak to like how appropriate data integration of all these data sources really helps enable clinicians to be much more effective and efficient with their time.
Yeah, I think so. I feel like we've touched on it tangentially throughout the conversation, but I'm glad that I get the opportunity to bring it together, right? So we've touched on the idea that wellness or health, right, doesn't happen in the exam room, right? So it's important, I think, to be able to provide clinicians that objective information of all of the things that are happening outside of the exam room to come back to when that health care exchange happens with a more comprehensive clinical picture. I think we've also touched on the idea that we need to be, very mindful of how that information is shared, right? So we don't want to bombard clinicians with a bunch of unfiltered information that is, it's like it's the FYI emails that you mentioned, Drew, right? Like, I don't think that that's what I would want as a doctor. But if I need to know this and it's something that I need to know and I need to take action, then I definitely want to know that. And so I think that as we have these increasing tools, as you mentioned, or tactics, right? So you're going to have your patients that are qualifying for a remote patient connection. You're going to have patients that are getting coaching. You're going to have patients that are getting just information from their wearable tracker on their wrist. All of this information is coming in. You have information that is coming in from a health system across the road. You have information that's coming in from the dental claim that you have no visibility into because you didn't even know if this patient had dental insurance or not, right? So when you grab all of that information, put it together, and then combine it and identify these are the top 3 things that you should know as a clinician and take action on, then that, I think, brings great value to that clinician's ability to deliver efficient care, and also builds trust, because you now have that comprehensive picture about that member, where they're not saying, oh, when was the last time that you saw the dentist? You already know that information's already there. So again, it's providing information to clinicians that matters in a way that is condensed and doesn't add complexity to the system.
Absolutely. I'm so glad you mentioned dental work, by the way, because dentistry is it's such a forgotten but necessary element of healthcare.
Right? I mean, like, it's association with heart disease, association with like preterm birth. I mean, there's so many areas that we can't forget our pearlies.
Yeah, I totally agree. Leah, I'm curious your thoughts on this. I mean, it's something I know that you spend a lot of time thinking about, the integration of all of this information in a way that your care team can be more effective. How do you, anything to add to what Dr. Rodriguez said?
Yeah, so with our clinical insights, it's important that we make sure that the users of that, whether it's the clinicians delivering our programs or the providers, are aware of the evidence behind it. And so we always push forward the background information, the journal articles, the research that we've done to back up these recommendations. Additionally, we are constantly putting these interventions and these recommendations through in-depth clinical outcome analysis. So we're measuring if this action that we're recommending is taken, what kind of impact can we see on the member's health profile going forward? We do that through our ActiveHealth Index, which allows us to quantify the scoring and the opportunity for improvement on that particular patient. And that's how we're able to prioritize some of those gap insights and those gaps in care that we're pushing forth to the clinicians, is by making sure that the top one is the one that's going to have the biggest impact. And sometimes, believe it or not, based on research, it isn't clinically intuitive. Sometimes it goes against what we knew as clinicians and our training as to which one we should work on first, because some of these care gaps, quitting smoking or using tobacco products, has such a significant impact on their overall health picture that I might get that one before I'm going to talk about that missing lab. That's an important care gap. But if I've got 5 minutes with a member, or I've got an hour with a member, what order do I want to go in? I want to go in the one that's going to be the most impactful and the one that has the research on the outcomes. And that's the safety behind our clinical insights that we push forward, is that all of our clinicians, both internally in our population health programs, as well as our provider partners out in the healthcare system, have that reassurance that we have both the evidence-based literature to back it up and the clinical analysis that we can stand behind and put our money where our mouth is. We stand behind these outcomes, and if acted upon, could have really significant impacts to your patient's health.
Yeah, that's awesome. Thank you. I really appreciate that. And maybe just to extend that one click further, from a patient perspective, I think there's also an opportunity to like over engineer for the patient, and create things there where it's just like you're hitting them with too much content, as opposed to getting them with like the right information at the right time. One of the things that we've seen with our programs is that patients really engage very heavily in the remote care programs that we power. 3/4 of patients are still recording readings at least twice a day after 90 days in the program. I mean, just really strong engagement. And 3/4 of patients feel like they're receiving better care. Over half feel like they have improved self-management of their condition. And the interesting thing about this is that what we don't have is daily education pieces and there's not like it's more, we are educating them or they are educated up front by their care team, which is you all, right? About, hey, here's why you're participating in this program. Here's what's going to happen, right? If you don't record readings, the system's going to remind you. And if you don't record readings for a while, we're probably going to call you. And there's like some built-in accountability. And that sort of accountability engine, if you will, sits in the middle and helps the patient and the clinician have a better interaction. But outside of the patient, taking the readings that they have, and then maybe if a certain reading sparks like, hey, we should probably provide some certain education content, it just kind of stays in the background, right? And other than just making sure the patient's taking their reading, like that which gets measured gets improved, right? And I think that's what happens there is the patients start to see their numbers, they start to learn about their own behavior. There's a really great story from a gentleman named Dr. Aaron Neinstein at UCSF. And a few years back, he published a blog article on a diabetic patient, a senior diabetic patient, I think the person was 70 years old, who was always having trouble controlling his sugars. And Aaron said, hey, listen, Dr. Neinstein said, listen, I'd love for you to try a continuous glucose monitor just for a few days. And patients like, I don't think I need that, doc. My diet's fine. I'm telling you, it's not my diet. And Aaron's like, I think there's something going on with your diet, buddy. Like, can we just try the CGM, right? And so the patient tried the CGM, and within the week, he reached out proactively to Aaron, to Dr. Neinstein, and said, oh my gosh, you're right. Every single morning, I'm having a banana and a glass of orange juice, and every single morning, my glucose is spiking, and I can see it on my continuous glucose meter. And I thought that was healthy. I thought that was okay for me. And it turns out it wasn't, right? And so just another great example where, by getting the patients the right tools and having the clinician support them in that, they can really learn a lot about their health. So with that, I think we're close to time. Dr. Rodriguez, thank you so much. Leah, thank you so much. Any final words, any last comments?
Drew, I think your story just now about the patient learning that what he envisioned was healthy, right? His banana and orange, which at first glance goes back to just what we've been saying, right? Information is power, and having that information of changes perception, right? So you were able to use that information to empower that patient to actually make the realization themselves and then make that change, right? So it wasn't imposed on them or anything, and ultimately got them to be healthier. Love the story. I think it's a perfect example of how we can gather data and then put it back in an actionable way in the hands of those that will take action, whether it be a provider or a patient, and really impact on health.
Absolutely. Yeah. Cool. Well, thank you so much. I really appreciate both your time. This was an awesome discussion. And thank you everybody for listening in. To note to the audience, if you have any questions for follow-up, if you just email us hello@validic.com, let us know. We will follow up with you after. Again, thank you so much for everybody. Thank you to participants for joining. Leah, I really appreciate our time and looking forward to talking again soon.
Thank you all.
All right.